for joining us on the show tonight. We having okay? Thank you, Doctor, for joining us tonight. Very, very worrying reports just about some hours ago, I think 24 hours ago or so, where it appears about 20 doctors died as a result of COVID-19. Let's begin with that. How are you responding to such news of your colleagues and frontline workers dying as a result of COVID-19 and are here as a result of an inadequate personal protective equipment, PPEs?
Decision to you. I must say that it is a very sad period for doctors in the country to have lost about that number within a week all over. I must also say that part of what we are using to mitigate that is to keep creating that awareness amongst colleagues, to say that every patient must be presumed to be COVID-19 positive. And we also appeal to our patients to also tell us their status. I will tell you one thing, part of what we have noted is that even these travel COVID-19 tests that you are supposed to do, we are aware that a lot of people are even cutting corners, even at the airport. They didn't do the test, but they will pay to get their way, those to say they are negative. These are part of the things that shouldn't be happening. So for us, what we are saying is that everybody should remember that COVID-19 is very much around. And as doctors or health workers, we are 3 times at higher risk of contracting the disease. That's possibly what has put our colleagues' life in the line. And I must say that it's our duty to keep making sure that we keep Nigerians safe. So we are putting everything in measures in place to make sure that we do our best to combat and contain the virus, but we still want government to take care of us. All these people that have died, what is government going to do to their families? Even those of us that are still alive as frontliners, people are being owed salaries, are being owed allowances. They talk about insurance for all of them. How many insurance have they done for anyone? The first time that we have this COVID, we have to talk about second wave right now. Right as we speak, there are still people who are being owed 4 to 5 months of their allowances for being frontliners working in isolation centers.
Dr. Adetunji, I mean, this is very, very disturbing and worrying. I mean, especially for you frontline, the frontline workers there. We understand what exactly you're going through. But help us understand, as there are talks of a second wave of the COVID-19 in Nigeria, there are also talks about a new variant of the, I think it's B117, I think that's what it's called. Help us understand all of this and make sense of it. How worried should Nigerians be at this time?
The truth is that we should remember that microorganisms can mutate, because they have the genes coding for every thing, that genetic material, and they can mutate. Sometimes mutation can make you less virulent. So it's not every mutation that makes you higher virulence. You might even mutate and die from it, from that mutation. So, but what we are saying that there's a new variant compared to the one that have been isolated, that everybody seems to be being transmitted all over. So having a new variant, like people are saying, is more deadly and whatever. Yes, a lot of things going on like on that with scientists. But all we are saying is that even after the initial COVID cases that we've found, COVID-19 cases that we've found, we are here to diagnose everybody, test everybody. You know, at the time we stopped testing. We started saying that only those that have symptoms should be tested. And I think that's what is still going on. But what we are saying is that we should test everybody. But we are also aware that government seem not to have enough funds to put that through. But we are saying that all these donors, we need to call for more help. Everybody needs to be tested, whether you have symptoms or not. But economically speaking, and cost-effective way to do it is to test those that are presenting with symptoms. And there are people who are even running away from doing the test because when you see the form that be used to fill your name when you present for a test or present to the hospital, if you get COVID-19, he has not necessarily said that you have COVID-19, but you will see patient and clients saying they don't want to go ahead because they are labeled COVID-19 without doing the test. So they will refuse to do the test. And you're not going to compel anyone to go ahead and do a test. It's voluntary testing. So people need to do the test. Now, going to what is going on about the second wave, all we need to keep doing is to maintain those protocols that we have always been given, even at the first one. What we are having there is that we are testing more again, and we are getting those increased number. People have traveled. Those that are traveling are supposed to do a test before leaving their own country. And when they're also leaving that country where they have traveled to, back into the original place where they left, they're also supposed to do a test while also isolating in the country where they left from. But the truth is that people are cutting corners. I have that information that people are even cutting corners at the airport, paying their way out to say they are negative. This is not good. This should not be
Very,
encouraged and should not even
very
be happening.
worrying indeed. Very, very worrying indeed, Doctor, because we are absolutely pressed for time. There are talks of another lockdown, but this has also generated fears in the minds of many Nigerians, because it does appear we haven't even recovered from the first lockdown. Is this something you would subscribe to? Another lockdown?
Honestly speaking, nobody will subscribe to another lockdown. But if push comes to shove, I'm sorry, that's what we are going to do. And we may not be able to do anything against that. I will say that a lot of action went on during the first lockdown. There were people who were looking for food to eat. We're not even talking about palliatives that are being kept in places that are doing the extra process, were not being brought out. We're talking about people who couldn't even fend for their daily livings. So I'm a bit worried that people have soon forgotten all those sacrifices. People have soon forgotten what they put in line. People have soon forgotten the effort of Nigerian doctors during that time. A lot of people died, including non-doctors, citizens. So those sacrifices should not be allowed to go away like that. So this is the time to continue to follow the guidelines, increase awareness. People say, in fact, I was shocked to hear some people saying there's no COVID-19, that it doesn't affect Nigerians or Africans. I'm sorry.
Very
People
worrying
should
indeed.
don't even try to find out how your body will react when you have the virus. Yes, they say we don't die much, but why do you want to know whether you are part of those that will die or those that will do well? So everybody should prevent the virus and do the right thing to make sure that we continue to have a good, healthy nation. But I must say that I don't subscribe to lockdown, but if push comes to shove, that may be the only way to make people follow the protocol.
Dr. Adetunji, would like to thank you so much. That's where we have to anchor our conversation with you tonight on the show. I'm afraid we cannot go any further because we are pressed for time. But we'd like to thank you for your thoughts, thank you for your time, and thank you for your insight on Galaxy TV. Well, ladies and gentlemen, that's where we anchor our conversation on the show. Tonight, earlier we had Senator Shehu Sani, a Nigerian politician and human rights activist. We also had a former lawmaker with the House of Representatives, Honorable Kehinde Odeneye, and from Barcelona, Spain, artist soul and Nigerian musician joined us to just share his views about the pandemic and updates from Spain. And then just a while ago now, the NMA chairman here in Lagos, Dr. Tunji Adenekan, speaking about the second wave and imminent lockdown here in Nigeria. Well, it's the last edition of the show in 2020. 2021 is just around the corner, 3 or 4 days to go. We definitely want to hear from you and how we can make the show better. We have a number, I think it's displayed on the screen right now. Talk to us and share with us what you think we can do to improve the show as we resume next year, 2021. But one thing is certain, as we keep talking about issues of national interest, Nigeria will prevail, and it's not time to give up just yet on Nigeria. My name is Kelly Egiga, and I will see you again next time, that is next year, on the show. Good evening.